My name's Carrie Siegel. I'm an abdominal radiologist at Washington University in St. Louis. And I have a subspecialty interest in GU imaging, but I do all aspects of abdominal imaging. So the question is, what do we know about growth rates of renal cell carcinoma? And how do these growth rates affect management? So years ago, there were many studies done on growth rates of patients with a solid renal mass. And there were many different studies done by many different people, and they all kind of similarly landed in the same area that most renal cell carcinomas were growing about 3 to 4 millimeters a year. Now, I will clearly state that these studies were not double-blinded, controlled studies where people randomized into one option or another. So all the people who did not undergo surgery were patients that were lost to follow-up, didn't have medical insurance, had many too many comorbidities. So they were very skewed studies. But nevertheless, interestingly, they all had similar information. And if anything, we might suspect that those patients might have a worse prognosis because they had worse, maybe cardiac output, an additional malignancy, didn't have health insurance, many medical and even socioeconomic factors that might put them at a disadvantage. So the studies are what they are. They're not perfect, but about 3 to 4 millimeters a year. And what we need to realize is that radiologists' inter-observer variation is about 2 millimeters a year. So we're going down very tight in numbers. Now, some renal cell carcinomas grow very slowly. Some will even grow 0 in a year. And very, very rarely a renal cell carcinoma can involute and sort of infarct its blood supply and get a little bit smaller, and then later with time get bigger. So we really can't use growth rates a lot in terms of lesions that don't grow at all in a year. Certainly could be renal cell carcinomas. And renal masses that do grow may be something else. Angiomyolipomas can grow, and angiomyolipoma could bleed and just look a lot bigger. And there's other renal lesions that can get bigger: lymphoma, metastases, oncocytomas, pyelonephritis can get bigger. So growth rates are sort of difficult. The one thing I do want to stress is it's very unusual for a renal cell carcinoma to grow a lot. Most tend to grow about 3 to 4 millimeters a year, maybe up to about 15 millimeters a year. So if we're looking at a CT, and the mass has grown about 2 centimeters in 6 months, we should be thinking of lymphoma or metastatic disease. That's very, very atypical. So what we have learned is that the small renal masses can be safely followed, and they're not going to metastasize while they're undergoing follow-up, for the most part. People have done large studies, and masses that are about 1 to 2 centimeters inside have about 2% incidence of nodal mets and about 4% incidence of distant metastatic disease. That's not a lot. And renal mass is 2 to 3 centimeters in size. It goes up a little, about a 3% incidence of nodal mets and about 5% incidence of metastatic disease. Once we get over 3 centimeters, things are starting to creep up, about a 4% incidence of nodal mets and 10% incidence of metastatic disease. So usually masses under 3 centimeters we can safely follow. If masses are staying the same in size or even slightly involuting, that doesn't give us an enormous amount of confidence to exclude a renal cell. It might be a more indolent renal cell, but we can't exclude a renal cell. Growth in the 3 to 4 millimeters is what we typically see, and rapid growth, we should be thinking about other things, especially lymphoma and metastatic disease. Now, everything that I said has a caveat, and that is very rarely we unfortunately identify renal masses in women that are pregnant. And I'm not sure if it's progesterone associated, estrogen associated, just increased blood flow, but renal masses in pregnant women tend to have really incredible growth. both benign renal masses, angiomyolipomas and oncocytomas, and malignant renal masses, renal cell carcinoma. So this information that these renal masses can seriously grow in pregnancy needs to be factored into management of every young woman of childbearing age. Because if we saw a 2-centimeter mass in a 60-year-old woman, we would treat that and manage it very differently than a 2-centimeter mass in a 30-year-old woman who's not yet had children. It's much more worrisome. They tend to grow like crazy. So that's the only caveat to all those, all that information I gave on growth rates. Everything's sort of a little different in pregnant women where they tend to grow a lot more, and management for those women tends to be a little different.